next presentations. All right. So you ready, Sumaya?
Yeah.
Okay. You wanna share your slide?
Okay.
Yes. Go down below green share screen.
Did you see my screen now? Hello everyone, my name is Sumaya Nasher, under supervision of Professor Sohaili Shwadri. Our presentation today is about the therapeutic use of stem cells in diabetes mellitus. Diabetes mellitus is a chronic metabolic disease with high morbidity and mortality. Recently, stem cell based therapy for diabetes mellitus has shown considerable promise. We reviewed articles where diabetic patients will receive stem cells for therapy and followed for half to 4 years after therapy. Over 200 diabetes mellitus patients took part in 10 different studies by different investigators from different countries. In majority of the patients, diabetes mellitus affect blood glucose, insulin, C-peptide, and glycosylated hemoglobin levels among other parameters. HbA1c is a stable marker that primarily reflects the average of fasting plasma glucose level in the past 3 months, and the information on C-peptide levels reflect the level of synthesis of endogenous insulin even in individuals receiving exogenous insulin. The definition of stem cells is the body's raw materials which all other cells with specialized functions are generated under the right condition in the body or a laboratory. Stem cells divide to form more cells called Dura cells. Stem cells can be guided into becoming specific cells that can be used to regenerate and repair diseased or damaged tissues. This photo shows that these Duracell either become new stem cells by self-renewal or become specialized cells by differentiation with a more specific function, such as blood cells, brain cells, liver cells, heart muscle cells, or bone cells. Stem cells are classified according to their differentiation into many different types. The most common are pluripotent and multipotent, and according to their organ, into embryonic and adult stem cells. Mesenchymal stem cells are involved in development of mesenchymal tissue types and can be harvested from umbilical cord blood and also remain present in several adult stem cells niches, including bone marrow, adipose tissue, mesenchymal stem cell classified as multipotent and are able to generate multiple cell types that share a common embryonic origin, namely the mesodermal germ layer. There are many stages of stem cell therapy. First step is mobilize of stem cells from bone marrow to blood using growth factor a few weeks before the procedure. Then the stem cells are harvested from bone marrow, placenta, umbilical cord, fat, or from other tissue. After harvesting, cells need to be cultured in a laboratory in a sterile environment for 3 to 4 weeks to increase the stem cell population, then injected to the patient by IV or close to the damaged organ. Stem cells have the ability to turn into healthy version of the damaged cells and repair the injured tissue. From here begins the most important part of the presentation. Table 1 showed that type 1 and type 2 diabetic patients were included in this study. Most patients receive autologous cells. Only the first one, they received allogenic cells. The advantage of the autologous cells are much less chances of rejection. A large number of patients were recruited in each group, total of about 200 patients, considering these are human subjects. Table 2 show that as these are diabetic patients, they all have blood glucose and insulin management and associated problem. We labeled these problems as basal problems related to diabetes. The number of stem cell injected were in the range of 1 million to 4 billion cell per kilogram body weight. The injection sites are either IV or pancreatic artery. The duration of the study was from 6 months to 4 years. No one showed any adverse effects during the study period, except in 3 groups with minor transit problems in a small number of patients. For example, mild vomiting and nausea. Table 3 shows that all patients showed improvements after the study. For example, reduced fasting blood glucose and HbA1c, either free of insulin intake or reduced level of intake. C-peptide level increased in all patients, decreased in inflammatory T cell counts and inflammatory markers, decreased glutamic acid decarboxylase antibody titer. After analyzing all studies, we found that all 10 studies continue for 6 months to 4 years after the stem cell injection procedure. The result of this analysis showed improvement in glucose, insulin, C-peptide, HbA1c, and daily exogenous insulin requirement after stem cell treatment of diabetes. In type 1 diabetes mellitus, bone marrow hematopoietic stem cell is a good source of stem cell transplantation. In type 2 diabetes mellitus, HbA1c and daily insulin requirements were significantly improved after mesenchymal stem cell therapy, and bone marrow mononuclear cell therapy significantly improved insulin requirements and C-peptide levels. Stem cell transplantation can be a safe and effective approach for therapy of diabetes mellitus. Available data from these clinical trials indicate that the most promising therapeutic outcomes was the one seen in mobilized hematopoietic stem cell. Early stage stem cell therapy after diabetes mellitus diagnosis is more effective than later stage intervention, and well-designed large-scale randomized studies are urgently needed in patients with diabetes mellitus, considering stem cell type, cell number, and infusion method. For more information about the impact of stem cells on diabetes mellitus, you may visit these sources. At the end of my presentation, I would like to thank Professor Reginald Dorselli, Hostos Community College, the City University of New York, CRSP C-STEP program, Natural Science departments, and thank you, Professor and peers, for your attention.